What are the main four principles of a nutritarian diet?
Well, the nutritarian diet is designed to be like the gold standard of nutritional excellence to maximize human lifespan and slow aging. And the foundational principle, which is represented by the equation H equals N over C, talks about having a good micronutrient bang per each caloric buck, that you're getting a good micronutrient excellence or adequacy per calories you're consuming, picking foods that have a lot of antioxidants and phytochemicals and vitamins and minerals, particularly green vegetables, with that acronym GBOMS, which identifies those foods that have the strongest anti-cancer effects in the scientific literature, standing for greens, beans, onions, mushrooms, berries, and seeds. We're trying to go after not just nutritional quantity, but also nutritional diversity. So a wide variety of food types in the diet, expanding, not eating only those foods, but we're focusing on those foods to make sure we highlight them, to include them in your daily menus. So the first principle has to do with nutritional density and nutritional adequacy, micronutrient adequacy. The second principle, of course, has to do with trying to achieve hormonal favorability, the right level of hormones. And that's referring predominantly to the glycemic effect of your diet. If your diet has like honey and white flour, white rice, things that are where the blood sugar raises in response to eating that food, you could have a higher circulating level of insulin. And being overweight makes your diet more hormonally unfavorable because you become more insulin resistant with more fat on the body. And then, so that's one thing that's very unfavorable to a person's longevity, is eating high glycemic carbohydrates. And the second thing is animal protein, in particular, animal products, which hormonally drive cellular replication. The extra protein, the completeness of the amino acids drive IGF-1, or insulin-like growth factor 1, which also is a growth-promoting hormone. Those two hormones, insulin and IGF-1, if they rise simultaneously, like they do in most Americans who are eating like macaroni and cheese and hamburgers and pizza, and they're eating, white flour and animal products, the combination of those two hormones raising is most dangerous for promotion of cancer and, of course, cell proliferation and premature death, increasing the aging process. So we're trying to keep animal products either very low or eliminated, and, of course, to keep high glycemic carbohydrates. Our most favored carbohydrate are beans and peas and lentils, because they're so high in resistant starch, they're high in protein, and they have slowly digestible carbohydrates, which don't require much insulin because their body is absorbing the carbohydrates at a slow pace. And you don't need much insulin when it's coming in so slowly. And they're also very rich in protein. So we try to reduce the higher glycemic carbohydrates and stick to more peas and beans and fruits and root vegetables. In any case, the third principle has to do with making sure nothing's missing in your diet. We call it comprehensive nutritional adequacy. In other words, you could have the healthiest diet, eating all the kale and strawberries in the world, but if you're deficient in B12, vitamin D, zinc, K2, DHA, your one weakness, your one thing that's going to be your downfall was that one aspect where you were nutritionally deficient. So we use modern science and sometimes testing to make sure people are adequate. And so we're recognizing that a vegan diet, or what some people call a plant-based diet, I don't know if that means vegan, I'm not sure, really plant-based doesn't really mean that. But as we approach a diet with less animal products, we reduce exposure to some nutrients, predominantly B12, DHA and EPA, which are commonly fish and seafood and small amphibians like reptiles and snakes and frogs. And of course, zinc. Zinc could be low. So B12, zinc, and even iodine could be relatively low in some people. So we're making sure, and vitamin D based on sunshine and type of skin tone you have. And so we're just assuring people, sometimes with using supplements, sometimes with using blood tests, to make sure they have comprehensive micronutrient adequacy. They're not low in anything that the human body needs that's going to create an additional problem for them. Lastly, the fourth principle is avoiding toxins, chemicals, parasites, and other dangerous bacteria. In other words, keeping your diet clean, where that's where organic and growing your own food and not eating foods that have chemical or metal poisonings. And of course, we've contaminated the oceans with plastic, and we get microplastic particles in seafood. But of course, there's plenty of toxic materials and plant matter too, especially the GMO and the stuff used with Roundup and all the chemicals we put on certain foods. So and the arsenic now in brown rice. So the last principle is keeping your diet as clean as possible. And so we try to put together all those factors that could affect a person's potential health between the ages of 80 and 100 years old, particularly making sure plant-based eaters don't get two diseases that are at risk for. One is dementia, Parkinson's, due to that is increased risk and shrinkage of the brain with DHA deficiency. And some people don't convert ALA from flax seeds and walnuts into EPA and DHA as readily. And my 30-year experience taking care of elderly vegan communities showed a higher risk of this problem in healthy vegans living very long time. We don't want to see them losing their memory and brain shrinkages. And even if they get, with most people, they'd be dead by the time they're 85 or 90. But with these healthy people, we want them to keep their brain function intact. And the studies show that with an omega-3 index below 5, you start to see increased risk of cognitive impairment and brain shrinkage with aging. And so we're trying to achieve, with supplementation when necessary, the omega-3 index above 5. And the second thing we see in elderly vegans and plant-based eaters is a higher risk of hemorrhagic stroke, not ischemic or embolic stroke or heart attack, but hemorrhagic stroke if they're still eating considerable amounts of salt in their diet. What I'm saying is you could become more sensitive to the endothelial inflammatory effects of salt, and salt becomes chronically leading to microvascular hemorrhages and irritations in the endothelial lining, over the years weakening the blood vessels. And without a high degree of atherosclerosis and fat on the body, the fragile blood vessels in the brain aren't coated with fat, so they can potentially rupture, especially when there's a combination of high blood pressure and salt consumption. So we want people to not just switch one type of heart stroke to another. We also have to be salt conscious. Considerably is important to be salt conscious to maintain that, to not have that risk of hemorrhagic stroke.